today recognizes the 218th anniversary of a fatal epidemic in the U.S.
In the summer of 1793, yellow fever took the lives of over 5,000 people in Philadelphia, Pennsylvania. Yellow fever causes its victim to become jaundice, which is a slight yellowing of the skin and eyes. Hence the name yellow fever, or Coqueletida fuscopenida.
Yellow fever epidemics have occurred in various places around the world and throughout history. They occur often in areas where mosquitoes are abundant, because they are the pests that carry the disease from one host to another. The first recorded epidemic was in 1648 in the Yucatan Peninsula in Mexico.
There are an estimated 200,000 cases of yellow fever, causing over 30,000 deaths each year around the world.
We will now go to Melissa Achedu, our on-scene reporter in Philadelphia. Melissa?
Thanks, Eleni. I'm here with Dr. Reagan Trapp, a leading doctor in the study of yellow fever. Reagan, can you tell us a little about this dangerous disease?
Yes, there are multiple stages of this disease. If a patient survives, they will acquire lifelong immunity.
Dr. Reagan Trapp also told me that yellow fever cannot be spread from human to human. The Aedes aegypti mosquito carries a virus called the flavivirus. The mosquito gets that virus from a monkey which it had previously bit. When the same mosquito bites a human, the human may become infected. Because it's a viral disease, it's difficult to treat, especially once the disease develops far enough. The most you can do is treat the symptoms and hope they have a strong enough immune system.
Thank you, and again, that was Melissa Achedu, our on-scene reporter. One of the worst epidemics of this yellow fever was in 1793 in Philadelphia, but reports of outbreaks in places like Brazil continue even in present time. To protect themselves from this virus, people who live in areas of high risk should get themselves vaccinated. This vaccine is successful in making over 95% of its recipients immune to yellow fever.
Once a person is infected, there are 5 stages that they may go through.
These are the 5 stages of yellow fever. The first stage is the incubation stage.
This stage usually lasts about 3 to 6 days.
After a person is bitten by an infected mosquito, there's about a 5 to 20% chance that they will develop the disease. Following the incubation stage, an invasion stage occurs, which can last 2 to 5 days. During this stage, as the immune system fights the disease, it may win and the person could recover quickly.
For several hours to several days after this stage occurs, the patient is in the remission period. For some patients, they may recover after this period, but for others, this is just the calm before the storm.
The most potentially fatal stage follows the stage of remission. This is known as the intoxication stage. This stage is also often accompanied by kidney failure, and the mortality rate for this stage is over 50%. If a victim survives these stages, then they will recover with no long-term side effects and will also have a lifelong immunity to yellow fever.
Coming up, what's up with the Kardashians?
And in local news, Glenbrook South High School has won the award for this high school with the most school spirit. Woo!